Dear UIPM athletes, welcome to our next anti-doping podcast. Today we will discuss very interesting topics. Firstly, we'll focus on medicine contamination and some anti-doping cases in regards of this topic. And in the second half, we will focus on how oral health can impact your sports performance. Christian, welcome.
I'm glad to be here again.
I think this topic is quite interesting for both of us. As we know, not all doping cases involve intentional cheating. Some positive tests are caused by contaminated medicine or even supplements. But still, strict liability rule is in place, and athletes are responsible for any prohibited substance found in their body. However, anti-doping investigations may determine no significant fault or negligence if contamination is proven. So let's focus on medication, how it can actually happen that medication can be contaminated.
It can happen for various reasons. In the past, there has been several cases of medicine contamination with diuretics, and I would say that these cases were the reason why we are talking about medicine contamination today, because they were the first ones. And the reason lying behind these contaminations is that the sensitivity of instrumentation in accredited laboratories that do doping control is higher, so they're more sensitive, these instruments, than those ones that are used in general pharmaceutical manufacturing. So, for example, we have had products that were compliant with GMP procedures when it comes to pharma industry, but they were not compliant with the code because they contain very low trace amounts of certain diuretics.
So that's how precise and specific anti-doping is, right?
Which is unfortunate for our athletes, but that's the state of art.
But to clarify, we are still speaking about traces of prohibited substances in pharmaceutical products. There are many reasons for that. We can have manufacturing cross-contamination, which can happen. We can have contamination during packaging, impurity in raw ingredients, so plenty of
in very low concentrations.
WADA has some approaches to these contamination cases. You mentioned diuretics. So how diuretics are that specific to this topic?
You know what? So these cases were the most prevalent when it comes to diuretics and when it comes to 6 specific diuretics. And WADA's approach was to do some research, and based on that research, minimum reporting levels has been established for these diuretics, and they're all the same for the 6 substances, and the reporting level is 20 nanograms per mil in urine. And the regulation is that if the concentration in athlete's urine sample is higher than 20 nanograms per mil, it is adverse analytical finding. And when it is less than 20 nanograms per mil, it is highly likely that it is due to contamination, and therefore no test report is generated. And in this way, our athletes are protected from diuretic contamination.
I found statistics that diuretics are the most presented substances as a contaminants in pharmaceutical products. Why diuretics are that frequent as a contaminants?
You know what? It may be due to the fact that the most prevalent illness that adults have is hypertension, and diuretics are often used in treating hypertension, and most of the pharma companies have some products in their portfolio, including diuretics as well.
So let's switch gears and let's go to some cases. Let's have a look on a typical investigation. So athlete is notified of a positive test, and how it is different from regular case when the contaminated pharmaceutical product is in place.
So here we have to distinguish that the minimum reporting levels are there for diuretics, but not for
We have other
all of the substances. We have other contaminants as well. For example, trimetazidine. We will talk about the substance in this podcast as well. So when the athlete has feeling that the adverse analytical finding may be due to contamination of a certain product, the athlete always, after the first notification, has possibility to explain the adverse analytical finding, usually in the first 7 days after receiving the notification, and the athlete can explain to anti-doping organization that it may be due to contamination of pharmaceutical product, and therefore he or she can gain additional time to do some analysis. In each case, if the athlete wants to prove contamination, there has to be laboratory evidence. Ideally, the athlete has opened container of that product. Ideally, the athlete has declared the product on the doping control form. And with having this evidence, they can gain opportunity to have their product analyzed. For example,
What do you mean they can gain the opportunity?
Well, if the athlete wants to have the product analyzed by WADA accredited laboratory, it has to be agreed on with the anti-doping organization. The athlete also has the opportunity to have the product analyzed elsewhere, but it is preferable if it was done in WADA accredited laboratory with the agreement of anti-doping organization, and the anti-doping organization or hearing panel can also do some investigation and find that exact product with the same batch number that is sealed and ship it to laboratory as well. And if in both opened container and sealed container finding is confirmed, so that prohibited substance that caused anti-doping rule violation is there, the athlete has not won yet. Here, what is important is what was the explanation of the athlete. So if the athlete explained that he or she used that product 3 days before the competition in that exact amount, there has to be expert opinion if that contamination of that product used 3 days before the competition in that certain amount could have caused the same concentration that has been found during doping control in urine. So, yeah, the athlete has it very hard to prove contamination, but certainly there's the opportunity to do so.
Yeah, it sounds very difficult, and you were describing situation in ideal way that we have or athlete has everything like open package, exact package of that. But I can imagine that this is not a real life in
Yeah,
every
some
case.
athletes might have cases like, oh my gosh, my head is hurting. Hey, John, do you have some pills, some analgesics? Yeah, I do. And yeah, that analgesic could have been contaminated, and you do not have opened container.
And that's it.
And that's it. And you have not declared it on the doping control form. Yeah, real world cases are difficult.
You've already mentioned trimetazidine as an example of a contaminant, and nowadays we can say that trimetazidine is very, very common as a contaminant, not only for pharmaceutical products, but for dietary supplements as well. And we have 2 case studies. We have 2 female tennis players, Iga Świątek from Poland and Nicole Bartoňková from Czech Republic. And at the beginning, I can say was similar about these cases. Both of these athletes were positive for trimetazidine. Iga Świątek received 1 month and Nicole Bartoňková 6 months suspension. And in every case, no significant fault or negligence were in place. So how we can explain the differences?
So let's talk about the differences. the main difference is in the product that has been used. So the Polish tennis player used over-the-counter medication that has been sourced from a reputable pharmacy in Poland. So on one hand, we have a medication that has been contaminated, and on the other hand, we have a Czech tennis player that used supplement, which was contaminated. So here we see the difference on how medicines and supplements can have different results in results management, and that is because the medications have stricter rules for their evaluation and quality management than supplements. And what is interesting is that both players used trimetazidine not intentionally. The Polish tennis player used melatonin because she was traveling a lot and had sleep issues, and she used this over-the-counter medication to fight jet lag. And the Czech tennis player used milk thistle extract for her liver, and she used it as a supplement and had a different outcome of the proceedings.
So our athletes must be very careful with pharmaceutical products as well. At least they need to have some follow-ups of those doses.
Sure, and I don't want to scare the athletes with the pharmaceutical products. The contaminations are much less common than in supplements. Supplements are much riskier than medications, but be aware of the fact that the contamination can happen with medications as well.
When we move to another part of our podcast, it's quite interesting to speak about how athletes can improve or impact their performance. And athletes are usually focused on optimizing training, nutrition, recovery, but oral health often is not part of performance programs, I suppose, which is quite normal.
It isn't.
I would say. But when we consider that the mouth or our oral health can become a source of chronic inflammation, it can really improve the performance, not in a good way. So taking care of our oral health is actually a good recommendation. But let's start with maybe a deeper look in our mouth. So what can happen in our mouth which can trigger these chronic issues?
You know what, if the oral hygiene is not good enough, or if we have dental problems that we do not solve and we wait much longer than we should, we can develop cavities, other problems with our oral health as well, chronic inflammation, and so on.
How is it connected to sport performance?
That is a good question. And that is a question that has been investigated in 2024. So these findings are quite new and interesting as well. So the hypothesis was that we should look at the oral health and if it impacts the athletic performance. And to do so, we had to look on what is available in research. And the investigators that did this looked at observational studies. They have done systematic review of published articles. They have found 800 which were relevant. Then they looked through them. They have selected 14 that could help to solve this issue. But when they were reading the full texts, they only found 8 articles that could be used. And they did meta-analysis on these articles. And in 6 of them, there has been found significant influence of bad oral health on self-reported athletic performance. So we are not looking at controlled clinical studies, which would be ideal. We have observational studies that had been done with questionnaires of the athletes.
And those reported impacts were focused on reduced training participation, lower training volume, pain, fatigue, higher injury risk. So quite serious impacts on the performance.
And they also have calculated the risk and of the decline of the athletic performance. And the investigators or researchers have found that there is potentially 1.5-fold decrease in athletic performance when the oral health is not good enough or good.
Yeah, to be precise or to be honest, we have to say that those analyses or studies they were evaluated only on a basis of athletes' reports or self-reporting, I would say. So this is something which is a bit tricky.
Mhm.
So that's why we can probably just say that oral health or periodontal disease is associated with sport performance or reduced sport performance. It's not the causative agent. On the other hand, they also focus on higher creatine kinase, which is specific parameter for muscle damage.
Mhm.
And in this case, we have some more exact data, right?
We do. And as you have said, you know what, I would consider these findings as preliminary findings, but how we could solve this issue is quite easy. And I think it would be beneficial for the athletes for their sake, not only for the athletic performance, but I don't know, general health and life issues as well, to take good care of their oral health. And if the athletic performance can be this way improved as well, that is a good benefit.
We have also found some interesting facts about why athletes have more risks in this regard.
Mhm.
And I can name some common risk factors like frequent sports drinks, which contain a lot of sugar, carbohydrate gels. You know, they are really concentrated sugars, right? Acidic beverages, dehydration, reduce saliva during exercise, high carbohydrate exposure during training. So, if we combine those factors, we can really see why athletes are specific group, even in oral health, not just in performance.
Sure. And to add to that, athletes often have very busy schedules and they can sometimes forget.
So let's focus on some practical tips for our athletes. What about sport drinks?
Use them only if necessary.
Hydration,
If the athletic activity has duration less than 60 minutes, water is enough.
oral hygiene.
Well, you should
Brush your teeth.
brush your teeth at least twice a day. Twice a day is a good recommendation, but also take care of your interdental spaces and use interdental brushes at least once a day.
What about flossing?
Flossing, you know what? I personally do not like it, but if someone has really close interdental spaces, then flossing could be good enough as well.
What about dental screening? Do you think that athletes needs more?
I would say if you comply with the general recommendations for general population, it could be enough.
I think that the best advice for athletes is that when they found some early signs of dental issues, like bleeding gums, swollen gums, bad breath, gum recession, or something like that, go as soon as possible to your dentist and deal with the problem. Because when you don't deal with it, chronic inflammation can have a huge impact.
Yeah, your health can be impaired, but also your sporting performance. So think about that. And I would also really focus on doing a checkup with your dentist at least once a year. In Slovakia, we go to the dentist once a year for general checkup, and if something comes up, we can do it more often. And we also visit dental hygienists that do professional dental hygiene. And I've visited this person once a year before. But the last time that I went there, she has told me that one time is not enough according to new recommendations, and I should do it at least twice a year.
Even though researches we've mentioned have some limitations, and we still can say that oral health is associated with performance, not a causative like agent. Maybe we can just close it up saying that elite athletes optimize like every detail of their training and recovery. So maybe oral health is another piece of puzzle that can help, if not improve, just to maintain your
It
performance.
sure can.
Thank you for listening to today's episode, and like looking forward to seeing you next time.
Until the next time, see you
Bye.
guys.